This podcast is a production of iPro. The primary purpose of the podcast is to educate. Listeners acknowledge that they are not being provided any advice or services by the speakers. The speakers are expressing their views and opinions only, and not that of any company or agency for whom they work. Any reference to a specific product or entity does not constitute endorsement of that product or entity. The podcast is for private, non-commercial use only. Please visit our website at ipro.org for our full disclaimer.
Welcome to the Kidney Cast, where we focus on end-stage renal disease. The Kidney Cast is a production of iPro, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. We welcome all listeners, including dialysis patients, dialysis professionals, and those who just want to learn more about end-stage renal disease. I'm your host, Shazina Ndiapan. In today's episode, we are observing two important months: March, National Kidney Month, and April, Donate Life Month. During these 2 months, we join a national initiative to raise awareness about kidney health, dialysis, and organ donation. I'm excited to introduce Caroline Sanner as my co-host today. Caroline, welcome to the podcast. Before we get started, can you tell me a little bit about yourself?
Thank you so much for inviting me today. It's great to be here. My name is Caroline Sanner, and I'm a registered nurse and a director with the iPro ESRD network, where my work is focused on improving access to kidney transplantation and helping patients better understand the transplant process. I started my nursing career as an active duty officer in the Army Nurse Corps, caring for service members, veterans, and their families in the hospital setting. I've also worked in clinical research, and for the past 4 years, my work has been centered on kidney disease and transplant access. A big part of my role is helping patients make sense of what can be a very overwhelming transplant journey, but I also work closely with providers to make sure transplant education doesn't fall through the cracks. When providers feel confident having these conversations and patients feel informed and supported, that's where we see real progress.
Caroline, thank you for your introduction and thank you for your service. I'm so happy that you can join me in this episode. Let's kick things off by talking about Kidney Month. March is dedicated to raising awareness about kidney health and preventing kidney disease. Our kidneys might be small, but they play an important role in keeping us alive. Millions of people have chronic kidney disease and don't even know about it until it's too advanced. That's why awareness is so important. Caroline, can you talk about some of the risk factors for kidney disease?
Absolutely. One of the hardest parts about kidney disease is that it often develops quietly without obvious symptoms. So understanding the risk factors really matters. Some of the biggest risk factors include diabetes and high blood pressure, which together account for the majority of chronic kidney disease cases. If either of those conditions is not well controlled over time, the kidneys can slowly become damaged. Other important risk factors include heart disease, a family history of kidney disease, and long-term use of certain medications like frequent use of NSAIDs such as ibuprofen. We also know that kidney disease disproportionately affects certain communities, including Black, Hispanic, Native American, and older adults. That's why it's important for individuals to have routine screening and open conversations with their providers. The big takeaway for listeners today is, if you have any of these risk factors, you should be asking your provider about kidney health, even if you feel fine. Early testing is simple, and catching kidney disease early can truly change the course of your life.
Thank you, Caroline. Kidney disease can progress silently, so knowing your risks and getting checked early can make a huge difference. Caroline, what are some of the symptoms of kidney disease?
That's a really important question because one of the biggest challenges with kidney disease is that early on, there may be no symptoms at all. A lot of people feel completely fine until kidney function is already significantly reduced. When symptoms do start to appear, they can be pretty nonspecific. Things like fatigue, swelling in the legs, ankles, or around the eyes, changes in urination such as going more often or less often, or having foamy or dark urine. Some people notice shortness of breath, muscle cramps, or trouble concentrating. This is why awareness is so critical. By the time symptoms show up, kidney disease is often already advanced, but early testing gives people a real chance to slow progression and plan ahead.
Awareness is everything. The more we talk about kidney health, the more we can empower people to catch problems early. So let's share this information with our loved ones. Let's keep these conversations going, and let's spread awareness in our communities. Caroline, what are the steps or tests a person can take to detect kidney disease?
Because symptoms can be subtle or not show up at all, the most reliable way to check kidney health is through routine blood and urine tests, often done in a primary care setting. Your kidneys act like filters. Their job is to clean waste and extra fluid from your blood. When they're not working properly, waste starts to build up, and that shows up on blood tests. Damage to the kidneys will also allow protein to leak into the urine, which is why urine testing is so important. These are simple tests that a provider can order, but they don't always get discussed unless you or a care partner asks. So if you have risk factors like diabetes, high blood pressure, obesity, or a family history of kidney disease, it's important to talk to your primary care provider about kidney testing, even if you feel fine. Early detection gives people the opportunity to slow disease progression, protect kidney function, and make informed decisions about their care.
Thank you again, Caroline. Get screened, know your numbers, and talk to your doctor about kidney disease. Take charge of your health. It's very, very important. I want to shift gears and talk about those who have already been diagnosed with kidney disease. For these individuals, it's about managing the condition, staying on top of medication, treatment options, and really leaning on to social networks, whether this can be family, friends, or professionals. Being on dialysis is a huge life adjustment. There are several options available for dialysis patients, which includes different treatment modalities, such as in-center dialysis, home modality options, and transplantation. Caroline, can you provide a brief overview about kidney transplantation?
Of course. A kidney transplant is a surgical procedure where a healthy kidney from a living or deceased donor is placed into a person whose kidneys are no longer functioning properly. The transplanted kidney takes over the job of filtering waste products, maintaining fluid balance, and performing other functions that help keep the body healthy.
And can you explain how kidney transplant work, both from the living and deceased donor?
A living donor transplant happens when someone donates one of their kidneys while they are still alive. This is often a family member or a friend, but sometimes it can be someone that the patient does not know personally. Living donor transplants are generally considered the best option when available because they tend to last longer, work right away, and can often be done sooner in the disease process, sometimes even before a patient needs dialysis. A deceased donor transplant comes from a registered donor who has passed away. Patients are placed on a national waiting list and receive a kidney when a compatible one becomes available. Both options save lives, and not everyone has access to a living donor. But knowing about living donation early gives patients and families more time to explore all of their options.
Thank you, Caroline. Every April, National Donate Life Month is observed. During this month, we honor those who have given the gift of life. That's through organ donation and tissue donation. And we encourage more people to become organ donors. Caroline, can you tell us why Donate Life Month is important?
Donate Life Month is a time to recognize just how many people are waiting and how big the need is for donors. Right now in the United States, over 90,000 people are waiting for a kidney transplant, and that is just for kidneys. Kidney transplant makes up the vast majority of the transplant waiting list. Every day, people die waiting for a match because the number of organs available does not meet the demand. They might wait years for a compatible kidney, especially from a deceased donor. That's where donation matters. Registered deceased donors give hope to many through decisions made ahead of time, and living donors, who are people who choose to give one of their kidneys while alive, help shorten wait times and expand opportunities for transplant. A living donation can mean a transplant in months instead of years. So during Donate Life Month and beyond, increasing awareness, having conversations about donation with your family, and registering as a donor can make a real significant difference in the lives of people waiting for a second chance.
Thank you, Caroline. In closing, I just want to remind everyone that both kidney health and organ donations are something we all can take action on. Whether it's scheduling a checkup, spreading awareness, or registering as an organ donor, you can help make a difference. Supporting the annual Donate Life Blue and Green Day on April 10th. You do this by wearing blue and green to show support. You can also help spread the word by talking to your family and friends about organ donations. You share information on social media or share stories to help raise awareness. Another thing you can do is register as an organ donor. Many states allow people to register as an organ donor when they get their driver's license or ID card. You can also register through your state donor registries. Caroline, I wanted to thank you for joining me in this episode.
Thank you again for having me. Kidney health and organ donation are areas where small actions like starting a conversation and registering as a donor can make a meaningful difference. I'm grateful for the chance to help raise awareness during National Kidney Month and Donate Life Month.
Links to more information about this work can be found on our website, iPro ESRD Network at esrd.ipro.org. If you are new and not familiar with the ESRD function, please refer to the network's resource called Empower Yourself to learn more about our network's program. You can also look at different type of resources that we have available on our website. That's it for the Kidney Cast. I'm Shazina Andiapin. Caroline, thank you again for joining me today.
If you enjoyed this podcast, please leave us a comment and subscribe. Please let us know what topics interest you or what you would like for us to cover by emailing esrdnetworkprogram@ipro.org.
We will be back soon. Until then, we'll be working on better healthcare realized.